Hello, my name is Dr. Allen and I'm a GP. This video is in response to concerns about the changes in accessing general practice. Please share with anyone you think may find this helpful. Over recent years, the ways to get help from general practice has changed significantly. However, these changes have not always been explained to patients. Concerns include patients not being able to be seen face to face or not allowed to request a GP. Many patients have felt confused, abandoned and angry. If the changes were made due to COVID, why isn't general practice returning to business as usual? As a GP, I will try and explain. In the past, to see a GP, all you had to do was ask. Now when you ring, a receptionist may ask you about your problem. You may be offered a phone call from a GP or to help from a different professional. Many people think, but I just want to see a GP. Here is the background to the problem. Patients are living longer, with more medical problems and many more medications. The complexity of general practice has vastly increased, but the numbers of GPs has declined. General practice was overwhelmed for years before the pandemic added further strain. One solution was to introduce new roles, such as nurse practitioners, pharmacists and physios. These professionals are highly skilled and knowledgeable in the areas that they specialise. The GP's particular role is to manage patients with complex or multiple medical problems and to support the team. New services have also developed, such as eye units and minor injuries units, so now there are lots of options. If patients are allowed to choose whom they can see, GPs rapidly become overbooked. This often happens as first come, first served, or for example, ring from 8:30. One problem with this is that GPs will spend time with patients who could have been managed well with another member of the team. And with the GP now fully booked, the most complex patients have no one available to help them. An alternative to this is called triage. Triage is matching your problem with the most appropriate person to help. The receptionist asks a little bit about your problem and is trained to pass this on to the right person at the surgery. If a problem turns out to be more complex than expected, we all have access to the expertise of the whole team. Strict confidentiality is followed by all staff. This new way of working may feel uncomfortable, but using the whole team to manage the needs of all our patients is what matters most. So why did this change during the pandemic, and will it change back? Many surgeries used triage to help manage workload more efficiently before the pandemic. However, when COVID came along, every surgery had to move to triage to manage infection risk. The hidden benefit for these surgeries was that triage also enabled them to increase the total number of appointments. And now with general practice close to breaking point, many surgeries will continue to work in this way. With triage, we can help more patients and prioritise those who need us most. When will GPs start seeing patients face to face? Contrary to common belief, GPs have continued to work face to face throughout the pandemic. We triage patients to a face to face appointment where we feel that the benefits of being seen outweigh the risks of COVID transmission. Going forward, the amount of face-to-face appointments will continue to reflect the COVID risks, and we're hopeful that both will continue to improve. Most patients and health professionals prefer face-to-face appointments. At times they're needed medically and to build the relationship. Many surgeries increased their use of telephone and internet during the pandemic. At times this can be safe and effective and also saves time. If we want to provide quality care in an underfunded general practice, we're forced to make uncomfortable changes. To help cope with these pressures, we need to balance the preference for face-to-face working and the efficiency of the alternatives. Lastly, there are concerns that doors remain locked. Walking into surgeries last year, we had patients with COVID, patients without masks, and vulnerable or unvaccinated patients. Queuing indoors was not safe. Surgeries introduced intercoms to help manage this. As the risk of COVID decreases, most surgeries will return to open doors. We know that changes in services that you rely on can make you feel insecure, neglected, or vulnerable. This is especially true when it's something as important as your health. General practice could have explained these changes better. Whilst appearing less visible, GPs are actually delivering more appointments than ever before. Triaging patients to the most suitable person may feel restrictive, but it helps make sure that the GP is available when you need them. Achieving what is expected of general practice with the workforce we have is now a near impossible task, but we've never stopped caring deeply for our patients. These changes are because we want to help ensure that you still get the care that you need.